Hey, good afternoon, everybody. Thanks for joining us today to learn about the AO's new healthcare program. This is Julie Caulfield, and I'm the Executive Director of AO. I will be your main point of contact for any questions about this new member benefit. I probably won't be able to answer all of your questions right away, but luckily we have partnered with the Small Association Leadership Alliance to make this program a reality, and they are a wealth of knowledge and have a help desk that will be readily available to us. We are very excited to be able to offer this healthcare program as an option for lowering healthcare costs for our members and your staff. It's an alternative approach to solving real problems in our industry, and we're glad that you're here today to learn more about it. My contact information is located on the AO website, and I encourage you to connect as you explore this program. Hillary Wicks is also joining us today, and she'll be fielding your questions during the webinar. Please locate the comment box at this time and feel free to write your questions during this webinar. Kevin and Rich will be answering them at the end of the presentation. Without further ado, I'll turn over the webinar to Kevin Kennedy and Rich Lawson with the Small Association Leadership Alliance. Gentlemen.
Great, thank you, Julie. Welcome, everyone. We'll try and keep the webinar to as short as we can and get through all the information and answer your questions. But let's get into it. So we're talking about the SALA healthcare program brought to you by AO. And the program itself originally started around 3 years ago as we tried looking for a solution for all of us with the ever-increasing cost of healthcare. Originally, we thought we'd be able to form a national association health plan, but that was simply not possible. But we continued looking for a solution. And in doing so, we had two items that were basically non-negotiable for us in our search. The first is that it had to be a national program available to all members in all 50 states. And then two, it had to reduce costs in a meaningful way. This program, fortunately, accomplished both of those. The program itself is really an effort to simplify what's become so complex with our healthcare. It's a high-end, affordable healthcare solution that offers a great choice of options and lowers healthcare by as much as 60%. And that varies by where you live. Some folks are seeing savings as much as 200%. Other folks, such as myself, are seeing savings around 50%. But in general, the average we're seeing is right around 60%. The program itself is really an alternative approach to traditional health insurance. And in bringing this program together, we have two main partners. The first is Apex Management Group, and the second is Sedera Health. The Apex plans offer coverage for preventative care and smaller needs, if you will, and I'll get into those in some detail, but there are two options to choose from, as you see there, the Advantage and the Basic plan. Members then pair that with a plan from Sedera Health, and there are 5 different plans to choose from with Sedera, and Sedera is medical cost sharing and offers coverage for the larger, significant, unforeseen type medical expenses, and I'll get into those details here in just a minute. But really, it's through Apex and Sedera, along with a couple other partners, is how we get to a comprehensive alternative that we're discussing today. Now, if you think about healthcare and our program in general, there are 3 main components. There are large costs that we incur at different times during our lives, and that's surgery due to an accident or hospitalization or diagnostic imaging or perhaps a cancer diagnosis. Then there's small to medium costs, which is a cold, sinus infection, and flu. And then there's preventative care. I'm going to address each one of these here over the next few minutes and talk about how each one are covered. And I'll start with the large costs. And again, large costs are everything from running your kid down to the ER to get some stitches to a cancer diagnosis and everything in between. And these large costs in our plan are handled by Sedera. Sedera is a medical cost sharing company. If you're not familiar with medical cost sharing, it dates back to the 1980s and had a foothold, if you will, with religious groups. Different churches or congregations would get together and form an organization through which their members can share in each other's expenses. Sedera's parent company is called the Caris Group, and the Caris Group is a medical bill negotiating company that was formed in 1988, and they're the group that many of the religious organizations turn to negotiate their larger bills. The Caris Group then formed Sedera. Sedera is built upon the same industry best practices and principles as the religious organizations, but Sedera does not have a religious component to it. Sedera's objectives are really all of our objectives. It's compliance and credibility. It's lowering our monthly expenses and then also reducing our out-of-pocket costs. So depending on the plan folks choose, it can save them money obviously on the front end with a lower monthly contribution, but then also on the back end with a lower max out-of-pocket. Medical cost sharing in general, again, it's big savings over insurance. As of the end of 2017, there were more than 1 million members sharing more than $1 billion. It also offers freedom from networks. So when you or your family have to use the Sedera portion of this plan, you can go to any hospital you like, any doctor you like. You don't have to operate within a network. On the Apex side, you do, and I'll talk about that in just a few minutes, but on Sedera, you can go anywhere you choose, and it also works overseas. Sharing begins at what's called your IUA, or initial insurable amount, and that's very much like a deductible on a per need basis, and I'll go through those details here in just a couple of slides. First, a quick graph just to illustrate the ever increasingly popularity of the program we're talking about today. You can see that uptick right around 2012 when all of our healthcare costs really started to increase in just a high rate. Folks started looking for an alternative, and the program we're talking about today is that alternative. Now, let's talk about how this actually works with Sedera. Sedera talks about these medical events in terms of a need. So what is a need? A need is one or more medical expense caused by a single accident or illness. So if you look at the graph there on the left, this is someone who broke their leg. So there was cost for the ride in the ambulance, the stay at the hospital, surgery, diagnostic imaging, prescriptions and pain medicine, crutches, physical therapy, all of those costs, whether they occur over a month or whether they occur over 3 years or more, but all of those costs are wrapped up into that one need and shared accordingly. Now, the patient's responsibility is the IUA. That's the initial insurable amount I just mentioned. And folks who sign up have 5 levels to choose from. They can have a $500, $1,000, $1,500, $2,500, or $5,000, and that's what they're responsible for paying out of pocket. So like I said, it's very much like a deductible, but on a per need basis as opposed to a calendar year basis. So sticking with the scenario there on the left with the broken leg, let's say the total costs there were $10,000 and you had selected the plan with the $1,000 IUA, you would be responsible for paying $1,000. The balance would be shared through Sedera and paid accordingly. Now this remains the same. If your cost were $2,500, you would still pay the $1,000 IUA. If your cost were $250,000, you'd still pay the $1,000 IUA. So when folks sign up, they just need to be aware that whatever IUA they choose, that's the amount they're responsible for paying out of pocket when they have such a need arise. Now, folks who sign up as an individual, they're responsible for the first 3 needs in any calendar year. If they sign up as a family, they're responsible for the first 5. As a practical matter, we all have far fewer than that in a calendar year, but if you did have a 4th, or as a family you had a 6th, you would not have to pay that IUA. Here's a real quick, real-life example of an of medical cost sharing. This is a family that had a young child with a persistent ear infection. On their traditional insurance, they had a $5,000 deductible. And after a series of antibiotics and booster injections, they went to an ENT who inserted tubes into the child's ears. On the left were the approximate out-of-pocket costs with their traditional insurance, about $2,500. On the right, in the scenario, if they had the $500 IUA, they would obviously only be responsible for paying $500. There are some nuances to the plan. Oops, sorry about that. Membership, medications, and pre-existing conditions. These next 3 slides are pretty critical to understanding how the program works. Let me start first with medications. There are basically 2 types of medications we all take, if you think about it, those that are curative and those that are maintenance. The curative medicines many of us take, such as antibiotics or chemotherapy drugs, or perhaps pain medicines related to the broken leg scenario I just gave you. These are medications we take for a period of time until we are cured. There's an end date to when we stop taking those medicines. The cost for the curative medicines would be wrapped up into that need that I just described before, and be a part of that math in calculating what your IUA is versus what is shared through the community. So the cost for those medicines are shared through Sedera. The other types of medicines many of us take, myself included, are maintenance type medicines. These are medicines folks take every week or every day or every month for blood pressure issues or cholesterol issues or maybe a thyroid issue, or I take it for rheumatoid arthritis. But these are medicines we take on a regular basis and will do so for the foreseeable future, if not for the rest of our lives. The cost for these medicines, there are 3 options. The first is the Apex plan. And I'll talk about the Apex prescription coverage in just a minute, but probably 90–95% of us on the program get our prescriptions through the Apex plan. It's managed by WellDyneRx, and it's a great program. That's how I get my medicine, for example, for my rheumatoid arthritis. Folks may also want to look at GoodRx or Liberty Benefits. Liberty Benefits is actually an add-on for $27.50 per month, and they offer very good discounts on prescription medications. I'll give you an example on someone who signed up for Liberty Benefits. It was a woman whose husband suffered from seizures, and the medication that he takes for the seizures is quite expensive, and so the most cost-effective way for them to get that medicine was actually to do the Liberty Benefits add-on. But like I said, 90–95% of us get all of our prescriptions through the Apex plan. I'll talk about that in just a few minutes. Also, when folks sign up, they have to choose or commit to a few things. One is to strive to live a healthy and balanced lifestyle. Obviously, making smart choices in our diet and exercise can improve one's quality of life, but it also keeps all of us out of the doctor's office and out of the hospitals, and saving us all some money. Members also have to commit to not use illegal narcotics and not to operate a vehicle while intoxicated. Also, tobacco users are certainly welcome to join. There is a $75 surcharge per month in signing up, but all are welcome to join. This next slide was the most critical for me because I do have a pre-existing condition, so I'll take my time here talking about it. When folks sign up, they have to disclose any medical event they've had in the prior 3 years, and that establishes their pre-existing conditions. Now, if they have any of the top 4 listed there, high blood pressure, high cholesterol, sleep apnea, or non-insulin dependent diabetes, there are no sharing restrictions. Those are obviously all pretty common and usually or generally well controlled with medication, so it's not an issue if folks have any of those. If folks have anything else or have experienced anything else, there would be sharing restrictions on them. Now, I'll use myself as an example with my rheumatoid arthritis. Now, certainly when I go to my rheumatologist, that's covered. My medicine for my rheumatoid arthritis is covered. The sharing restrictions come into play as if a medical event, if a need were to occur as a result of my rheumatoid arthritis, say, for example, I needed surgery. Well, if that happened in the first year, I would not be able to share the cost for that surgery. If it happened in year 2, I could share up to $15,000. Year 3, up to $30,000. After that's fully shareable, the time period has passed. So for me, signing up was not a problem. Rheumatoid arthritis is obviously a chronic condition and something that I will just have for the rest of my life. But there's nothing on the horizon that would create a financial burden for me and my family with my signing up. Now, if, for example, I had an active cancer right now, or perhaps was going through some tests, or if my wife was pregnant, now would obviously not be the time to join because that would create a financial burden for myself and my family, which is exactly what we're all trying to avoid. So for folks with pre-existing conditions, we definitely want to make sure everyone is completely aware of how this works and how the conditions are handled. But again, for about 80% or so of the U.S. population, our program is a great option, including for those of us with pre-existing conditions. But there are certainly some folks who are joining now would just simply not make sense for them and their family. So we want to make sure everyone's very clear on this. But those are the large costs. That's how they're handled. And again, this is surgery due to an accident or hospitalization or cancer diagnosis or a pregnancy, any significant medical event that we all go through. And significant not just in the nature of what we're going through, but also in terms of the cost. That's how they are handled and how they are paid. Now I'm going to switch gears and talk about the small to medium costs. Included in the program is a subscription to Teladoc. If you're not familiar with Teladoc, they are the largest provider of telemedicine in the U.S. And telemedicine is exactly what it sounds like. It's a great way to connect with a doctor over the phone or through your computer. And if necessary, that doctor can send a prescription to your local pharmacy. So many companies are adopting it. In fact, more than 75% of Fortune 500 companies now include telemedicine because it is a time saver and it's also a money saver. It's a time saver because you don't have to go down to urgent care or go to see your primary care physician if you just have a simple medical issue. Also, it's a money saver because you don't have a copay or anything of that nature. Everything is 100% included. I'll give you an example of a woman who I spoke to recently who used it. She had an infection on her eye, and when she conferenced with the doctor, they did it via video call. He identified what was wrong with her eye, sent a prescription to her pharmacy. She picked it up, and it was all cleared 3 days later. So Teladoc is very widely used. Also, they have one of the best apps you'll find on the App Store. Last I checked, it had more than 23,000 reviews and almost all 5 stars. So it's a great program that's very well run. And again, you can connect with a doctor regardless of where you are, in your car or at work or at home or in your office or wherever you might be. Also included is a subscription to SecondMD. SecondMD is a great way to get a second opinion on anything you or your family are going through, medically speaking, of course. Also, if you're having an elective surgery, Sedera requires you to get a second opinion, and you do that through SecondMD. And again, that's done virtually. It's not a heavy lift, but it's a great way to get a second opinion, obviously, if you're having an elective surgery, but also if you're just going through anything. And it's from some of the nation's top doctors that practice at places like the Mayo Clinic and Johns Hopkins and Harvard and elsewhere. So SecondMD is just a great add-on. But now let me talk about the Apex plans. Because if you recall, when you first sign up, you first choose the Apex plan that best fits you and your family, because the Apex plan offers coverage for the small to medium items, but also preventative care. You would then pair that with the Sedera cost, or the Sedera plan that I just reviewed. But the Apex plan offers two plans to choose from. This first plan is the basic plan, and about 20-25% of the folks who sign up choose this option. And it's a basic plan that offers 100% coverage for all preventative care needs. These are the needs that were defined by the Affordable Care Act. And you can see them listed there. There are 21 for adults, 28 for women, 31 for children. And it's everything from childhood immunizations and yearly physicals to colonoscopies and mammograms. Those are covered 100%. This first option then provides a framework for a health savings account. If you're not familiar with the health savings account, it's a great way to put away tax-free dollars to be used down the road for any qualified medical event you or your family are going through, such as dental or vision prescriptions or doctor visits, and also to pay your Sedera IUA. Now, the folks who sign up for this option are generally in good health. They don't go to the doctor very often. This first option does not have prescription coverage, so it's for folks who are, like I said, in good health, don't go to the doctor very often, but this allows them to put away tax-free dollars to be used towards future medical expenses, and also covers all their preventive care needs 100%. The rest of us, including myself, are actually on the Advantage plan. The Advantage plan also offers 100% coverage for all preventative care, 21 for adults, 28 for women, 31 for children. It then has the co-payment structure that many of us are used to. So if I go see my rheumatologist, for example, it's a $50 copay. If I see my primary care physician, it's a $20 copay. And this program then also offers prescription drug coverage. This is set up very much like what perhaps you have now. The prescription drug program is managed by Welldyne RX, which is a national pharmacy benefits manager. And you can see there's tier 1 and 2 generics, tier 3 preferred brand name, and it goes up from there. Just to give you an idea, the medicine I take for my rheumatoid arthritis is a tier 2, and it costs me $27 per month. So it's very much in line with what I've always paid. Now, when I talked about Sedera, I made note that Sedera did not operate within a network. You can go to any hospital or doctor you like. On the Apex side, it does operate within a network. It uses the multi-plan network. The multi-plan network is actually one of the largest networks in the U.S. There are nearly 1 million participating providers. So it has great coverage. It's one of the best networks we could partner with. And we've not had any issues in using the network because it's also a good paying network. So many doctors also join for that reason. You can see here, this is just a simple search for a primary care physician in a zip code local to the DC area where we are. And you can see it turned up a significant number of results. If you have questions about doctors in your local zip code, you can simply send us an email and we can run you a list of every doctor in that zip code or within 20 miles or whatever you desire as well. Or you can obviously go on the website here and look up the doctors as well. But let's talk price. Now, the prices listed here are what we all pay, regardless of where you live and regardless of your sex. So we're all paying the same amount. This first is for the Apex plans. Again, these are the first plans you choose when you sign up. On the left is if you sign up as a member only, or member and just your spouse, member and just the kids, or member and the entire family, meaning spouse and children. That second column there is the basic plan with the health savings account, and you see the price in there is $71 per month, or it goes up to $102. That third column is the Advantage plan. That's the plan that has the co-payment structure and has the prescription drug coverage. And then the arrow there is actually on the plan I'm on for $144.59 per month. And you then pair that with the plans from Sedera. Now, if you recall, there are 5 levels to choose from with Sedera. You can have an IUA that is $500, $1,000, $1,500, $2,500, or $5,000. For space reasons, as you can see, we have the $1,000 and $1,500 IUA listed here. On the left, MO is member only, MS is member and spouse, MC is the member and just the kids, and MF is the entire family, spouse, and children. It's then segregated by age, those in their 20s, 30s, 40s, 50s, and 60s going across the top here. And again, the arrow is actually the plan I am on for $175.51 per month. And there's my cost, $320 per month, and I have the $1,500 IUA. So for me, being in the DC area, my savings was right around 50%. Like I said, folks that are in more rural areas are saving significantly more versus what you can buy on the exchange. That's how we're measuring the cost savings. And then I have the $1,500 IUA. So let's say I break my leg. My responsibility for paying that would be $1,500. And again, it's capped at 3 because of the plan I'm on. So my max out of pocket is just $4,500 if I had 3 events, which would obviously be a bad year, but it's significantly less than my deductible was on my insurance plan. So for me, it saved me money on the front end with the lower monthly contribution, and then also on the back end with the lower max out of pocket. On the American Outdoors website, you can find all this information, details on the rates, the full listing of the rates, details on Sedera, the Apex plans. There's a great FAQ on telemedicine as well as 2nd.MD and the multi-plan provider search. A quick summary of the offering. Again, it's available in all 50 states, so it's a program that can travel with you. It does not need an employer sponsor, so individual employees can join. They can be full-time, part-time, and seasonal workers, hourly and salaried staff, and the cost can be paid by the employee or the employer. So if you have a business where you're able to offer healthcare to your folks, they can certainly, you can continue to do so and offset that with a payroll deduction. Or if you have a company where you're not able to, but you're obviously a member of American Outdoors, your employees can join and pay for it individually to get the healthcare coverage they need. Also, I've spoken to a number of your board members, and I know you have some seasonal workers. We have folks that have seasonal workers as well with different organizations, and what some of them have chosen to do is offer this to their seasonal workers. And then when the season ends, that plan for that individual can either be terminated or the individual could pick it up individually and pay for it on their own going forward. So it's a very flexible plan. Excuse me. Also, in terms of enrollment, to give you an idea, if folks enroll by the 19th of any given month, their coverage starts the 1st of the following month. So if you enroll by May 19th, coverage starts June 1st. If you enroll between May 20th and June 19th, coverage would start July 1st. Also, there's not a long-term commitment. You don't have to commit for a year, which goes back to what I was saying about the seasonal workers. Folks can enroll today, stay on for any period that they choose, and then leave the plan whenever it suits them. Also, you can see there again, the average savings we're seeing is about 60%. And then that last bullet there in the June-July timeframe, we're going to be offering some discounted coverages through Transamerica for life insurance and disability insurance, and also cancer coverages and things of that nature, things that will supplement your income if you do become ill. And it's also guaranteed disability, which is fantastic, especially for someone like myself with a pre-existing condition. Also, we're going to be adding a dental option in June. That's going to be on the Aetna network, and then also vision coverage through VSP, which will probably be in July or so. So those will all also be available on the American Outdoors website. Speaking of the website and how to enroll, you go to American, that link there. You can see all the information I mentioned earlier, and also at the bottom, there's a link to enroll. Enrollment is done online. It's a simple URL. As you can see, when you sign up, you'll need your personal info and that of any dependents that are signing up, as well as your banking information. After you enroll there, your information is transferred over to Sedera and to Teladoc, and then you complete a simple enrollment with both of them as well once you're done. But that is the program in general. Hopefully I didn't go too fast. Certainly welcome any questions folks may have. Hillary, are there any questions?
Not yet. Go ahead and start writing in your questions, everybody. And I'm curious, if somebody here is an owner of a business and they would like to offer this to their staff or seasonal guides, but they don't want to be paying for it for for them to get them signed up, are they just sharing the link with their guys? Do they have control over when that ends and things like that?
Yeah, so if their employees are going to sign up or enroll outside of the company, then the company would just simply share the link with them and they would enroll. And when they enroll, they would put in their name. Let's say they put in, Kevin Kennedy, which is my name, and then they would also put in the company organization that they belong to as well. But the billing, like I said, can either be handled to the individual or through the company. It can be handled either way, depending on the what's best for the company.
Gotcha. All right, here's a question. Are there cap limits to the coverage amounts?
There are not. There are not any cap limits to, I assume you're talking about the Sedera side. Like, I'll give you some behind the scenes on how Sedera saves their money. They do their best to prepay for surgeries. So let's say you tore your rotator cuff and you're having surgery in 2 weeks. You would call Sedera and say, I'm having surgery in 2 weeks. Sedera will most likely prepay for your surgery, or as much of it as they can, because in doing so, they save on average around 53%, which is pretty eye-opening for me. But I've had a number of conversations with hospitals over the last few years, and they will openly tell you that folks who prepay and pay in cash, they generally discount the cost around 50%. So that's how much of the savings is realized on the Sedera side.
Great, thank you. Here's another question. Is it possible for the employer to choose to pay a portion of the health coverage, or is it all or nothing?
Yeah, so it's all or nothing in terms of how it's paid. But what the employer would do, let's say they chose my plan for $320, they would do a payroll deduction to offset that cost with their employees. So maybe the employer is willing to pay $100 per month towards healthcare, whatever it might be. They would deduct the $220 from the employee's paycheck, per month, depending on their pay cycles, of course. But that's how they would offset that. Or others, I will also tell you, others have also not taken on that responsibility. They have their employees sign up, and they've added in extra money into their paycheck as well. So again, it can be done a number of different ways to best suit the company and the employee.
Great, thanks, Kevin.
Mm-hmm.
Other questions out there?
Let me just clarify one other thing. It's also rolling enrollment. So people can enroll at any time during the year. They don't just have to enroll in November, December, when open enrollment is for other plans. So people can enroll at any time during the year, and also leave the program at any time during the year. So like I said, it's a very flexible program.
There's another question here. Are there any set pre-existing conditions that are not covered at all?
Hey, say that again. I'm sorry, Hillary, what was the question? Any set pre-existing conditions that are not covered at all?
That are not covered at all.
No, again, there's a waiting period for pre-existing conditions, but only if the need arises. So again, using myself as an example, through the program, when I see my rheumatologist or get my prescriptions, that's all covered. But if a significant event were to arise, and I'll use again surgery as an example, that is when it would not be covered for the first year. And the second year, they would pay up to $15,000. The third year, up to $30,000. After that, once you hit the fourth year, it's fully covered. But it is phased in that way. But there's nothing that is not covered. But there is that waiting period for folks. And again, like I said, if someone's obviously going through a medical event currently, or perhaps they've just gotten through one and have not necessarily gotten the all clear from their doctor, they would most likely want to wait before joining and make sure that they don't sign up and again create a financial burden for them and their family, because that's exactly what we're all trying to avoid here with this program.
All right, I think that's all the questions for today.
All right. Well, if anyone has any other questions, please feel free to reach out to us. Again, you can go to the American Outdoors website, There it is. There's additional information out there. There's a great wealth of information, and also reach out to us with any specific questions you have. Also, we've done a number of webinars for employers. So if you're an employer and you have a number of staff that you're looking to bring on, we can do a webinar similar to this for you and your staff, and they can ask the questions and get the answers that they seek as well. So just let us know, and certainly appreciate your time today, and talk to you all soon.
Thanks, everyone.
Thank you.